Hi, thank you so much for joining me today. Today we're going to be talking about vitamin A, also known as retinol. Some roles of vitamin A in the body are that it helps to maintain healthy skin, teeth, skeletal tissue, soft tissue, muscle membranes, mucous membranes. It's good for eyesight, and it also plays a very important role in a healthy pregnancy and in breastfeeding. It can contribute to ocular health for mom and baby, development of the organs and the fetal skeleton, and it's very good to help maintain the fetal immune system. Here you see a chart that gives the recommended daily allowances from birth to breastfeeding women. And I got this from the National Institute of Health, the Office of Dietary Supplements. MCG is for micrograms, and RAE is retinol activity equivalents. Now, when it comes to nutrient deficiency in vitamin A, it is very rarely seen in Western and developed countries. If it is seen in those areas, it's most often seen in people with chronic medical conditions such as celiac disease, Crohn's disease, cirrhosis, alcoholism, and cystic fibrosis. It's more commonly seen in poverty-stricken communities and underdeveloped countries. Some signs and symptoms of vitamin A deficiency are severe dryness of the eye, and if this is left untreated, it will lead to blindness, night blindness, so having a difficult time seeing when it's dark, irregular patches of white of the eyes, dry skin or hair, constant fatigue. It can create a more weakened immune system, and when that happens, the patient can be more susceptible to infection, and it can also lead to infertility in women. When it comes to nutrient toxicity, the tolerable upper intake level, the maximum daily intake that's unlikely to cause harmful effects, is 3,000 micrograms a day. A large single dose over 200,000 micrograms, if that is taken in one day, you'll see signs and symptoms such as nausea, vomiting, vertigo, so feeling dizzy and off balanced, and blurry vision. And then long-term doses over 10,000 micrograms per day, you'll see your symptoms start to collect over time. It wouldn't be immediately, as you would see with the large single dose of 200,000 micrograms. So over a long period of time, if you were experiencing vitamin A toxicity, you would have liver damage, headaches, persistent diarrhea, skin irritation, persistent pain in your joints and in your bones, and the doctors would be able to see bone thinning. And the best way that this is treated is just to cut out vitamin A and let the body level back out. Now, vitamin A supplements versus food sources. The most common supplement that's seen for vitamin A is commonly seen in dermatology, so those retinoid creams. It's very rare to see any nutrient toxicity in these creams because most of the time it doesn't enter the bloodstream. Vitamin A is available in supplements, but it's not commonly needed in developed countries. Some food sources are green, yellow, and orange vegetables. For example, broccoli, spinach, carrots, squash. Fruits, cantaloupe, apricots, mangoes, dairy products, and this is the major source of vitamin A. Liver and salmon and fish. Some fun facts about vitamin A. So the body converts beta carotene into vitamin A, and this is often found in leafy greens, carrots, and cantaloupe. Vitamin A is often recommended to children who contract measles, and it can increase the likelihood of living instead of children succumbing to death when they are diagnosed with measles. While vitamin A is important in pregnancy, too much of it can be linked to birth defects. Studies have shown that smokers who take high doses of vitamin A supplements have an increased risk of lung cancer. And the age-old line of eat your carrots, they're good for your eyes, is due to carrots being high in beta carotene and vitamin A. Thank you for joining me today.